Coming up on Mayo Clinic Q&A, it's time to ask the Mayo Mom.
Not extinguish the behavior. It may stop the behavior in point in time because you've been hit, you've been hurt, you're going to stop it immediately. But long term, it does not stop the behavior. And in fact, the more corporal punishment that's used, the more behaviors that come out in these kids as they're getting older. So we actually see more of an acceleration of those behaviors.
Today we'll look at how parents can stop unwanted behavior from their child. What are the best practices to change that child's behavior? And how parents can use forms of correction other than corporal punishment.
We really want to make sure that people learn that there really is a whole different view about what corporal punishment does and what it does not do. And armed with that, it'll allow parents, I think, to make decisions that they're more comfortable with.
Hello, everyone. I'm Dr. Angela Mattke, and welcome to Ask the Mayo Mom on Mayo Clinic Q&A. I'm a pediatrician at Mayo Clinic Children's Center in Rochester, Minnesota, and host of this show about pediatric health topics. Today, we're talking about disciplining your child. We will be reviewing what the research tells us about the use of corporal punishment as a form of discipline and give you some positive and more effective tools at driving desired change in your child's behavior. Joining us for this discussion are two specialists in child abuse pediatrics at Mayo Clinic Children's Center. Our first guest, Dr. Derauf, is board certified in pediatrics and child abuse pediatrics. Our second guest, Dr. Arne Graff, is board certified in family medicine and child abuse pediatrics. And we are thrilled to have them join us today. Dr. Derauf, thank you for joining us. And Dr. Graff, thanks for coming back again.
Thank you.
Thanks, Angie. It's nice to be here.
Yeah, this is going to be a great topic. And I know it's something that all three of us are pretty passionate about. When I hear the term corporal punishment, especially before I got into medicine, I sometimes thought about like flogging or maybe even like, is this a military term when I hear the word corporal? So let's start by defining what that actually means.
So corporal punishment is a form of discipline. We often associate the words with spanking. But it's verbal, but more likely physical. It's something a caregiver uses to try and stop a behavior that's occurring. But when we think of corporal punishment, we're talking about inflicting pain on a child as a method of trying to stop that behavior, both short-term and long-term, at least in the caregiver's mind.
Okay. And do certain forms of causing pain on the child, is it encompass all different types like spanking, or does it include other things as well?
Well, in general, when we talk about corporal punishment, we're talking about inflicting pain because that's been the kind of the philosophy of it. It is something that gets their attention, stops the behavior immediately, and at least from times past was hopefully going to change the behavior long term.
Okay. And we'll get into more about what the research actually says about how it changes or modifies a child's behavior a little bit later. But I want to understand, how often is this used and kind of what are parents' thoughts, especially with the current generation raising children, about the use of corporal punishment? And I'm curious, has this changed over the years? Because I feel like anecdotally from generations and generations past, it seems to be much more accepted.
That's a great question, Angie. I think the good news is that over the last 40 years, there's been a fairly marked decline in the acceptance and use of corporal punishment. Back when I think, people in Arne and my generation were growing up, it was pretty much the norm. The vast majority of parents would use some form of physical punishment as part of their, disciplinary, so-called disciplinary strategies for kids' misbehavior. Over those 40 years, there's been somewhere between a 25 and a 40% decline in the acceptance and use. Having said that, the most recent kind of survey of parents still seems to show that the majority of parents feel that on occasion, hitting a child or spanking a child or whooping a child is still maybe an acceptable thing.
Okay. How do kind of parents in the U.S., their thoughts on this differ from other countries around the world? Is it similar, or is it a different kind of approach and acceptance?
So that's, I think that's kind of another good news story. In, I think it was 1977 or 76, Sweden became the first country to pass a law sort of prohibiting corporal punishment across their country. And since that time, there's been, a number of other countries have caught on. I think there's something like 67 countries now around the world that have laws against the use of corporal punishment, sort of all forms of corporal punishment, whether that's in the home or in the school. Unfortunately, the United States is not one of those countries. We're trying to, encourage the passage of those laws. But so internationally, the good news is that it seems to be becoming, less and less acceptable form of discipline. But we need to work on the legislation in the United States too.
Mm-hmm. Well, let's talk about the U.S. You mentioned that it's legal in probably all states in the U.S. What about the use of it in schools? Is that something that is, still permitted in states or used? I guess it's not something that I grew up with in Minnesota, being used in, when I was in school.
Right.
So it still is a common thing that we see in the school systems. There's about 19 states that still allow for corporal punishment to be used in the school systems, and that includes a paddle. And there is some shift with time in those 19 states, but the parents have to literally actively ask to not have that done to their children when school starts. Otherwise, it's allowed and practiced. And it unfortunately really is going to take the price and the toll on kids with behavior type issues. And some of the statistics kind of look at it and think that, again, minority population kids tend to be much more victimized of this in the school system.
Mm-hmm. Yeah, absolutely. Now, these kind of laws apply to only public schools, or are private schools exempt from these kind of laws depending on the state?
Well, the state law, those 19 states allows any school to do it. So then it's really going to boil down to school boards making some decisions on what they're going to allow or not allow.
Okay. Well, it seems like, sorry, Chris.
Angie, yeah. I think and Arne, correct me if I'm wrong, but I think in the 31 states that have sort of outlawed corporal punishment in schools, I think that applies both to, public and private institutions. Okay.
Gotcha. I think I hear this a lot, especially in the office with my patients, when I say, hey, what do you guys use for discipline? And just start having that discussion. But a lot of times parents will say, well, my parents spanked me and I turned out fine. And they'll start off with that before I even ask about, if they're using spanking and whatnot. I guess, what advice would you give to me to have in these discussions when parents say, well, my parents spanked me, or they used the paddle, or they used the belt on me, and look, I'm totally fine as a human being?
Well, and that, like you say, that comes up all the time in discussion with parents when you're talking about sort of, how to approach disciplining your child. Of course, these days we're really encouraging, positive parenting for kids, but when you specifically often when you talk about why not to use corporal punishment or physical punishment, you get that answer of I turned out fine, I was spanked, or I was hit or whooped when I was a child. I could say the same, I could say the same thing personally. And so my usual response, I think there's a number of responses. One is to respond that maybe you turned out fine in spite of, not because you suffered from corporal punishment. The other one is it really, that argument is suffers from what we call the anecdotal fallacy, that because you turned out okay, that the practice in general is okay. And it's the same sort of fallacy when someone says, I smoked 2 packs of cigarettes for 60 years and I didn't get lung cancer. Or, I didn't wear a seatbelt when I was a child and I didn't die in a car accident. It's a fallacy to think that because of your experience, that applies to everyone's experience. And we know, for instance, that smoking and not wearing seatbelts are bad for your health. So that's one way to respond. I think the other way to respond is that when we say that corporal punishment is not a good idea, it's you might have turned out okay because of it. It's really, we're talking about probabilities, and probabilities means that, some people are gonna do okay, and some people are not gonna do okay. And statistically, you're more likely not to do okay if you've, experienced corporal punishment.
Mm-hmm.
I think the other side of that, Angie, is that if you look from the child's perspective, as kids grow up, they have a different view, many of them, of what actually happened with corporal punishment. That it was it was my side, or my words didn't have much meaning. I had no control. You hurt me, particularly when people do whoopings and things like that. So I think it has, it clearly has an impact on the relationship between the caregiver and those kids, at least potentially it can. And that can be a pretty negative impact.
And I would say what I've witnessed, it seems like a lot of times the adults are angry when they do it. And there's no sense of calm. And sometimes it's really reactionary. Can you talk a little bit more about that?
Yeah, people have tried to look at whether or not the warmth when we're doing corporal punishment makes a difference. And certainly if people approach discipline, any type of discipline, in a positive, warm manner, as a parent who is supervising, and the kid has to recognize that they are in charge, then I think you have better success. But using pain and smiling or being warm doesn't make it any better in general. So it still is a concern that people who say, well, I'm a very warm person, yelling and screaming and striking a child is getting a message across of violence.
Let's talk a little bit more about like what the research shows. So not only does it give the message of violence, but I mean, what does the research show about this being effective, and what are the long-term effects of corporal punishment on children?
Yeah, so the research is pretty overwhelming, and it really is across the continents, and it's across cultural groups. And the research shows, number one, that it does not extinguish the behavior. It may stop the behavior in point in time, because you've been hit, you've been hurt, you're going to stop it immediately. But long-term, it does not stop the behavior. And in fact, the more corporal punishment that's used, the more behaviors that are come out in these kids as they're getting older. So we actually see more of an acceleration of those behaviors. We see more aggressive behavior in kids as teenagers, and even as adults, the concern about interpersonal violence being much more of a problem. We see cognitive or learning problems in these kids as they're getting older. And in general, what we see is that kids have negative impacts, greater risk of drug and alcohol abuse in this population, and just, again, problems with relations down the road, because violence is their go-to for resolving something.
Angie, there was a neat study where they actually recorded parents over time in their homes. They had parents wear a little recording device, and interestingly, you would think that people would not engage in corporal punishment when they know they're being recorded, but they do. And what they found was that the initial response of parents to misbehavior of their children is usually verbal, a verbal, response, a request by the parent for the child to behave appropriately. But very shortly after, not very long, within 30 seconds, parents would often resort to the use of physical punishment. And that did stop the children's misbehavior, like Dr. Graff said, very temporarily, but within 10 minutes of their misbehavior stopping, they repeated the same misbehavior. So it's effective for a very short duration at all, and we know that in the long term it's not effective.
The other side of this that is really important is if you look at the research that's out there, particularly some of the papers from Canada, when they look at physical abuse, they find that 75% of all the children who experience corporal punishment or physical abuse, it escalated from corporal punishment. And again, that's been seen by other groups also. So there is this, perhaps not intent to go to that point, but there is this kind of rolling forward that we see with physical abuse in these settings.
That's really interesting. What does the research show about the effects of like the relationship and attachment between parent and child? Anything regarding that area?
The research is pretty overwhelming and convincing that in multiple sort of domains of child development, their cognitive development, their emotional development, their their relationship with their parents, in fact their relationship going forward, as adults with other adults, all of these sort of areas, it's overwhelmingly shows negative impact of corporal or physical punishment on those domains of development. So it's it does have an impact on relationships.
Mm-hmm. Being a parent is hard. All of us have experienced, the frustrations and the escalation of tension, especially when, your child is doing a behavior that's not expected and they're not changing from that. And so I'm not trying to pass judgment on parents, but what I really want them to walk away by listening to this today is, what are some things that we can start to engage in instead to really foster those positive behaviors and try and diminish some of those negative behaviors?
Yeah, it's another great question, and I would just second what you say. Having had two kids and one child who was very colicky for the first year of life, kids can drive you crazy, and depending on how you were raised as a child, that really impacts how you perceive you're going to discipline your own kids. And so again, for those of us who grew up in an era when it was not uncommon to get hit with a belt or spanked or get your mouth washed out with soap or something, to change those behaviors is really challenging. So I think the first thing is to have a lot of empathy for what parents are going through, and to respond empathetically and understanding that being a parent is stressful at times, and kids can drive you crazy. But then it's to give them other options. These days we talk about positive parenting, and I have a number of things that I like to talk to parents about with regards to positive parenting. First is, and these were all things that I learned from colleagues and behavioral pediatricians who helped me raising my own kids when I was getting frustrated with them. First, having really high expectations for your children, because children like to meet their parents' expectations for them. And so if you have high expectations for them, they're going to try and meet those expectations. That was number one. Number two was catching them being good. So when you see them doing something that you like, a smile or a hug or just acknowledgement, looking them in the face, and behavioral people will talk about how you have to there should be a ratio of something like 5 to 7 to 1 for catching them being good versus catching them being bad. Because if all you're doing is catching them being bad, their kids are going to pay it. They're going to engage in bad behavior because they want to get parents' attention. So that would be another strategy, that we would talk about. And then just having lots of structure and consistency and routines. Those are really important for kids. Having limits, setting limits. Kids externally rebel against limits, but internally, setting limits makes kids feel good and makes them feel secure. Those are a few things that I would talk about.
Yeah, and I think nowadays, I think a lot of parents are dealing with issues like behavior, that we didn't know what to call it 40 years ago. We just got spanked on the knuckles with the rulers by the teachers and stuff like that. And I think though, being able to work with your primary care physician, with clergy, people around for support, to be able to talk about the frustration. I think most parents want their children to be good, and they want them to grow up good, as Dr. Derauf saying. And if you stop and think when you've spanked your child or you've just screamed at them, and you stop and really think about it, we all feel bad because we think how that must have looked to our kids and the picture we gave. So balancing that sense of, I need to be in charge and I need to help them learn so they don't get in trouble down the road, with how I do that. It's a challenge, but it's okay, as Dr. Derauf said, to realize that it is a tough job and you got a lot of resources. So using the resources really helps us kind of tackle this problem a little bit better and feel good about it.
Mm-hmm. I have a couple anecdotes I want to jump in with. So Chris was my kid's pediatrician for a while before he moved into full-time child abuse pediatrics. And one thing he really talked to me and my husband about was being mindful in parenting. And I'm not always mindful in parenting. I'm not the poster child for this, but catching your kids in those positive behaviors require mindful interactions between you and your child. It requires you to put your phone down and to the 25 million other things you have to do. And this is hard for parents. And I think this is especially hard for moms because we have, the second shift, the third shift, and the fourth shift now with COVID, which makes it even more challenging. But to catch your kids doing positive things, you have to be mindful. And sometimes parents will say to me like, well, they're just doing the things they're supposed to do anyway. But kids don't know they're supposed to do them unless we're constantly giving them that positive reinforcements to encourage more of those positive behaviors. And so the anecdote is that anytime my kids were really struggling with their behaviors, I'd catch myself being more negative, right? And just getting down on them and only catching them in these negative behaviors and giving them corrections or consequences for those. And a lot of times in our family, like we call it the reset button. My husband came up with this and it's usually in their armpits. And we push the reset button to try and break the negative cycle. And then we start to create some type of positive reinforcement system where we're only trying to catch them doing the positive behaviors. And it's like a light switch. And I wish we did this all the time and we try to do it, but it's so helpful. And whether it's all of a sudden we'll create a quick chart and I just throw stars or stickers every time I catch them doing something. And I don't even give them a quantity because with my kids, they're just so excited to get these positive things. It's great. Sometimes I'll just be like, all right, you just earned a point. They're like, how many points do I have to earn? I'm like 10 and we go to the park, and so it's not always as consistent as it should be. It's not what like the behavioralists would tell you to do is always having this consistent approach, but it's really helpful in those situations where we're having a rough day and it changes the outcome for everyone. And pretty soon everyone's, trying everything possible to be positive. And my kids are cleaning up when they wouldn't do it. And they're making up things to do just to earn a point, and I'm giving points for like the lowest hanging bar, right? When they're having negative behaviors, I'm like, oh my gosh, you got out of your seat. Thank you. And because sometimes you have to start really, really low to change those positive behaviors. And but I agree the kids also have to know the expectations of you. And so I think that's like what Chris said is having high expectations, but kids have to know what those expectations are. It can't just be osmosis and they're supposed to read your mind. So.
Yeah. And Angie, I love the reset analogy and, another, common used technique for kids' misbehavior is timeout. And I like to talk to parents about, actually putting themselves in timeout too, along with their child, because when kids misbehave, it makes us upset and we need to calm down too. And we need to role model, how we as adults often need to calm down. And so, sitting next to the child or, maybe a little ways away from the child when they're in timeout, and then you go into timeout too. And you both learn how to calm down.
Yeah, you taught me that with my kids when they were toddlers. And I would do that exactly. And I'd be like, mommy needs a timeout. And I would just hold them during that time and snuggle and they would be upset and we'd eventually get through it. But when that timeout ends, then it's time to, start encouraging those positive behaviors again and really trying to change the cycle. But yeah, I love that language. I think it's really important as a parent to teach your children modeling those behaviors when you're upset, and verbalizing them is really, really powerful to them. And they might not hear you in that moment when they're upset because their brain's on fire, but when their brain is calm and they're ready to hear you, then to say those things about mommy was really upset. I didn't handle that. I raised my voice. So I took a time out with you so I could feel calm. I love that. I think that's one of the greatest gifts you ever gave to me was teaching me how to do that. So thank you. Well, I want to move on now to talking about a policy that you both were really instrumental in implementing at Mayo Clinic. Can you tell us a little bit about that and what it means?
So it's called the no-hit policy or no-hit zone. It's actually something that was started in the Southeast United States by some children's hospitals, pediatricians, to try and make the environment in the hospital and clinic on healthcare campuses safer for kids and to help parents get some assistance when they need it. So Minnesota actually has legislated in law several years back that healthcare providers need to be protected because of violence that's occurred on campuses. Mayo Clinic was way ahead of the curve and had already been working on this to protect its employees. So we have a policy that does not allow for any violence on our campuses so our employees are safe. And they've expanded it so that it really covers all our guests, all our patients and visitors that are here. So they have the same right to safety. So that means no verbal and no physical violence can occur adult to adult, adult to child, child to child, and child to adult. And it's not designed to take away parental rights. It's designed to say on our campus, everyone should feel safe while they're on our campus. What you choose to do at home is your right. Just like if you choose to smoke at home, that's your choice, but on campus, you can't. Mm-hmm. At the same time, as you both have pointed out, raising children and coming to clinical appointments gets to be a long day sometimes, and kids get tired and frustrated. Yes. So what we want to do is we want our staff to be able to say to families, hey, it's been a long day. Anything we can do? Can we get some snacks for your child or some mm-hmm. crayons or something, so that we offer some alternatives to kind of help them get through their visit on our campuses. At the same time, to say, we also have some information about corporal punishment. And if you're interested, we'd like to give it to you because we don't want to force you to change, but we want you to be aware of really what the information says about this. And then talk to your primary care provider, because then you can visit about questions you have, and maybe it'll influence caregivers on how they're raising their kids and how they're responding.
I would add one thing in there. I think every parent is constantly apologizing to me about how their kids acting at their appointments. And if I could get one thing out there to parents, I'd say, quit apologizing. Like, we know what kids are like. We are experts in childhood behavior, and we expect them to struggle in these situations. It's not part of their routine. It's something different. They might be missing their nap. They might be hungry. There might be 6 other kids in the room with them. We understand that kids aren't going to sit there and be quiet and stuff, because kids are supposed to talk. They're supposed to move. They're supposed to play, all kinds of things. So I think parents often escalate like their feelings of being judged or their kids' behaviors in the office because they're so worried about sometimes how we're perceiving them. And we know kids do what they want to do. And it's hard, especially some of these kids who have long visits and they're seeing multiple different providers throughout the day. It can be really challenging for them. So.
And Angie, I just, add to what Arne said, it's really the no-hit policy that we've been fortunate to implement it, across the Mayo Clinic enterprise. It's really a way to try and, educate and role model what we think is sort of best practice. Mm-hmm. And what we're hoping is that, by doing that, by role modeling it diffuses out to the greater community, and that we hope that we can get other community agencies and community organizations and places to adopt similar policies, so that just kind of like how we approached smoking, mm-hmm. we can over time, change people's attitudes and perceptions about the use of physical punishment, corporal punishment.
Absolutely. Well, we've reached the end of our time. Do you guys have any parting thoughts that you want to share?
I just want to really emphasize to parents that are listening, we're not trying to make you change. We respect your right as parents, whether it's cultural or religious or ethic or whatever, how you decide you do things. But we really want to make sure that people learn that there really is a whole different view about what corporal punishment does and what it does not do. And armed with that, it'll allow parents, I think, to make decisions that they're more comfortable with.
Thank you, Dr. Derauf and Dr. Graff, for joining us today. It was fantastic to learn from you. Remember, everyone, get your flu vaccine, get your COVID vaccine, and stay safe.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts,